Well, welcome everybody to this week's episode of Dr. Jawbreaker. This week we have a gentleman that has what we call ankyloglossia. It has nothing to do with his ankle, but it has everything to do with his tongue. So ankyloglossia just is the technical term for being tongue-tied. So when you take a look, you're going to see how his tongue is tethered down, both in the posterior part of the tongue and then also on the anterior part on the inside of the jawbone behind the front lower teeth. A couple reasons why we want to get this done. One is just for better tongue positioning, for increased mobility of the tongue, and to improve the airway. The other thing that it does is when you get rid of that pull on the inside of the lower front teeth on the gum tissue, you can prevent recession, which is basically the gum shrinking and moving back, which could ultimately lead to the loss of those two front teeth. So what we're going to do today is something called the Zoggy technique, which is just a way of doing a frenectomy, particularly the posterior part of this frenectomy. We're going to use a combination of what we call sharp dissection, meaning some curved iris scissors. We could use a 15 blade for this as well. And a laser. The laser that we're using is a diode laser. I love the laser because there's a minimal amount of tissue injury, meaning pain and swelling afterwards is pretty minimal, and it cauterizes as it goes. So you'll notice when the laser is used, there's just limited amount of bleeding, both during the procedure and then also after the procedure. So let's go check it out. Feel how tight that little fiber is right there. And then on the inside, you can also see where the attachment of the frenum is to the attached tissue behind these two front teeth, and how that will ultimately lead to stripping the mucosa, recession, and loss of those two front teeth as well if we don't take care of that. So that's what we're going to do this little frenectomy. The technique that we're going to use is something called the Zoggy technique, which is an ear, nose, and throat doctor down in California that kind of came up with this unique little approach to get this done, which is a very well-controlled approach. So we shall do that. So I'm just going to retract here a little bit, and all you should feel is just a little pulling, and I'm just going to release this frenum a little bit in this area just so that we can get in here, start to open things up a little bit, and just find those strong muscle attachments that are in here. You okay? Expected, and it is. In fact, let me go like this. Here, can you see that?
Yep.
All right, bud. So the worst of this, you can just, thank you, is the smell. It's a little smelly just because it cauterizes as we go here. And I just release this back in this area so it no longer pulls. Also, the beauty of using the laser is that it doesn't really require any stitches afterwards. So, all right. So now we do this. It no longer pulls back there. A little bit more right there, just a touch. Okay. And then I'll put one little dissolvable stitch in here just to tighten that up, but otherwise we're released there. So that's that. I'm just going to test to make sure you're good and numb here, okay? All you should feel is just a little pulling, and that's it. You okay? Mm-hmm. Okay, good. Alright. Okay, Q-tip. And then you have a Kelly. So there's one pretty strong muscle band right there that you can kind of see. You see that, Kel? Mm-hmm. Okay. And this makes a clicking noise. Okay, hold on to that for me. Okay, and then you can come up. Kelly again. Okay, and then you can come up. Come on. Yep, one section right down. Okay. Correct? Mm-hmm. Okay. Kelly. You tell that soft tissue is still just limiting a little bit. That's not muscle. That's just the mucosa. You can tell that really increased the range of motion right there, didn't it?
Yep.
Yeah, now we'll dab in there. A little bit more right there. So I think what I'm going to do is Q-tip. Okay. I think we're actually good there. Got tons of motion. I went in here and we were able to go ahead and release the muscle fibers as well as the soft tissue and really radically change the amount of motion that you have. This procedure basically just dissects out these individual muscle fibers. You use the Kelly to go ahead and I'm just going to kind of simulate. You just kind of squeeze those muscle fibers so that you get hemostasis, so you don't get bleeding, and then use the laser to trim those, and you end up with this increased range of motion. Now what we're going to do is go ahead and put some stitches in here just to tighten that all up. And down here in the anterior, you can hardly even tell where we were. It's healing quite nicely, or I mean, it's not bleeding and it's going to heal quite nicely. It hasn't healed yet. That would be a little optimistic. Adding and stuff too. Your tongue will be internet famous, right? It's actually a profession, an influencer. All right, guys, I hope you found that entertaining and interesting. Procedure went right according to plan. A lot of the restriction of his mobility was actually in the mucosa. You'll notice that when the procedure was being done, there was a couple of muscle fibers that had to be lasered and released. But then once the mucosa was released as well, his mobility increased from maybe 1 centimeter to probably about 3 centimeters, which is a 3 times increase in movement. Sometimes I like to joke that they can now stick their tongue out and lick their eyebrows off to the side. It's just a joke, but she should have a greatly increased range of motion. As well, he no longer will have that pull on the soft tissue or the gums behind those 2 front teeth. So again, the technique is called the Zoggy technique, who's an ear, nose, and throat surgeon down south on the West Coast. Procedure went great. So if you have any questions, let me know. Remember to give us a thumbs up, to subscribe, and leave a comment down below, and we'll catch you next week.
70% overall drop in opioid use. And with the proper understanding and use of Exparel, you too can see the success that Exparel will bring to your clinic. Dr. McClelland, DDS, has been using it in his clinic for a few years now, and he's seen great success in his patients and their pain management every day. In this 6-video series, you get a professional masterclass that will give you the jump start you need to include Exparel in your daily routine. It includes a bonus PDF with a patient information handout, post-op medical instructions, and a quick look sheet for the materials and supplies for explaining Exparel. Go to Teachable.com today and get educated on a non-opioid anesthetic that will help your patients have a better day.